Hello, and thank you for joining us for this week's edition of It's Your City. I'm your host, Cortney Bloomer. Today's show is brought to us by Lake Tahoe Farmers Market, bringing a brand new farmers market to Carson City on Wednesday evenings near the McFadden Plaza. Our second sponsor for today's show is Mom and Pop's Diner, located right there in the McFadden Plaza, reminding you that they are open during construction. Today, our guest is Valerie Cauhape from Carson City Health and Human Services. Welcome, Valerie.
Thank you so much for having me today.
The health department has some big news.
Yes, we do. As of May 17th, we are actually Nevada's first accredited health department. So we were actually a group of one of 17 health departments that were accredited this quarter. We're very excited about that.
Now, accreditation, tell our viewers a little bit about what that means.
Okay, so the Public Health Accreditation Board, also known as FAB, released public health accreditation in 2011. So state health departments, local level health departments, and tribal health departments can all become accredited through this program. We began our process to move towards accreditation actually as a beta test site in 2010. So we were a part of their process in developing the accreditation process itself. So that was a really exciting opportunity for Carson City Health and Human Services. We then proceeded to start our community health assessment in 2010-2011, which was published in 2012. After that, we actually developed our Community Health Improvement Plan, also known as a CHIP sometimes. So in some of our documents, we'll refer to a CHIP, and it's that wonderful plan that brings community partner organizations together to work on different disparities in health here within Carson City. After that, we worked on our organizational strategic plan. So that looks at different aspects of our Community Health Improvement Plan and our Community Health Assessment, and really helps us decide what we're going to do internally to address those different issues and help keep things moving forward. We submitted our documentation for accreditation last May, so it's been a year now, and we finally just heard the results this week.
All right. This has been a long process. It's been going on for, like you mentioned, 5 years, and has involved Carson City Health and Human Services, and then also, as you mentioned, a number of community partners. What are some of the things that the health department has kind of learned from this process that's going to benefit our community going forward?
Our partnerships are really what has helped make this possible, not only for us, but also for our community. So, for example, Partnership Carson City, the school district, the fire department, Carson Tahoe Health, and several other partners, including Fish, have been really instrumental in helping things move forward. As far as other lessons learned, we've been able to strengthen a lot of our internal systems and really look at things that we can improve upon internally. We have been able to develop a system of quality improvement within our organization, and implementing that has helped improve communication, not only amongst coworkers who may be working in the same program, but also across different divisions of the health department, because there are the 5 or 6 different divisions of the health department. You've got clinical services, human services, public health preparedness, environmental health, epidemiology, chronic disease, and administration. And so having improved communication between each of those divisions really helps us to keep from reinventing the wheel every time we need a policy or something, and help improving clarity between of communications between the organization or the divisions as well.
All right. Now, accreditation is something that the health department has worked really hard for and has finally achieved after this 5-year process of hard work. Moving forward, what does accreditation mean to the community?
So accreditation means that the health department is able to function within the community at a level that is exemplary and meets national level gold standards, and that we're able to function at the same level as health departments in other states, other parts of the country, with different resources. And that's really exciting, because Nevada isn't necessarily the best funded state as far as public health is concerned. And so being able to do so much with that really shows that we're doing the best we can to improve the health of our community as a whole. As far as the organization is concerned, it also helps us show potential other grant funders to maybe bring some more funding into the state for public health, that we are able to function at that level. So we are hoping that we will be able to find programming later on down the road that can address some of those community issues.
All right. Now, the accreditation piece is certainly big news. It's gotten a lot of attention around Carson City. A number of the supervisors have provided props to the health department for this accomplishment. But it was a 5-year process. When are you going to have to do this again?
Well, we're actually already starting that process now because we did complete our community health assessment in 2012. That's something that has to be completed as per the FAB requirements every 5 years. Now, on the other side of things, hospital accreditation and the Centers for Medicare and Medicaid actually require that hospitals complete similar assessments every 3 years. So we're very lucky in that we're getting to partner with both Carson Tahoe Health and Carson Valley Medical Center on their community health needs assessment processes this year as well. So we may be moving that up to completing those community health assessments every 3 years instead of 5 years, which there's no problem with that as far as FAB is concerned, because that way we're making sure that we are assessing the community health in an overall manner at more frequent intervals, which is great because then we're not stuck with data that may no longer be valid.
All right. Now you're mentioning the community health assessment, which is certainly an important part of planning for the future. The health department just hosted a kind of community night to get feedback. What were some of the important things that came out of that meeting?
As far as the town hall was concerned, which was hosted at Carson Tahoe Health, so that was really great of them to help us put on that event. We learned that our community members really are interested in kind of the social services and access to health care issues in this community, which we totally understand are an issue, and we are striving to work towards facilitating some better referral process.
All right, so bringing people to services with the Affordable Care Act and access to health care and things, that's certainly something that's at the forefront of everyone's minds. Mm-hmm. Now, tell us a little bit about just the health department in general, for people here in the community who might not understand the services that the health department provides. You know, maybe they're familiar with the clinic, or, you know, maybe some of our local business owners have worked with the environmental health division, but people might not know, just in general, what is it that the health department does here in Carson City?
So some of the more public programs that we have at the health department do include environmental health inspections, restaurant inspections, as well as our clinical services department that also offers men's and women's health checks, well baby checkups, immunizations, and other services as well. We also have the Human Services Office housed within our organization, and they provide general social services help to the community. Other divisions that may not be quite so obvious to the public include public health preparedness, where that division of the organization actually holds programs that work with emergency services and with the hospitals and with other organizations in the region to help our community and others around us prepare for any sort of health-related emergency. And that could be the health consequences of a weather event. It could be the health consequences of an earthquake. It could also be maybe preparing for any sort of biological terrorism if that were to happen here in Carson City. And so it's really great that we have that division to make sure that we're protected as a community. Other divisions that may not be quite so obvious to the public would include our chronic disease division. We have several different programs to individually go out and work with our public, including Safe Routes to School, also tobacco cessation, and adolescent health education programming, which is my program, and we do adolescent development and sexual health for various age groups.
All right, so a lot more going on at the health department than people may be familiar with.
Correct.
All right. Well, when it comes to services and creating this next community health assessment and getting the community involved, what are some ways that people can become involved in that process and really have a voice in the future health of their community?
So as a part of our next community health assessment process, we are in the midst of completing 3 assessments, one of which for this process, so one of which collects just data from the state and from other sources, kind of see where our county really stands overall with certain health indicators. There's also an assessment where we sit down all of our partner organizations in a room and we talk about how well our system works as a whole. And then each of the hospital organizations have developed surveys to get input from the public. And so Carson Tahoe Health actually developed and has implemented a phone survey. And so if community members have an opportunity to participate in that survey, or if they have already participated in that survey, that's one of the things that we will be using within our community health assessment. Moving forward towards the end of the summer or maybe fall, we're going to try to bring not only our community partners, but also the public back together when we have the results of those first 3 assessments and say, this is where we stand. What do we know is coming down in the future that can affect the health of our community? And then what can we do to work together to move forward and create some actionable plans? And so that's really the first step in developing our next community health improvement plan and developing that framework for how each of the organizations are going to work together with the input of the public.
All right. Sounds fantastic. Valerie, send our congratulations to Carson City Health and Human Services. Once again, they have achieved accreditation. They're the first health department in the state of Nevada to do so. So congratulations to the team over there at Carson City Health and Human Services for all of their hard work. And thank you so much for being here with us today.
Thank you so much for having me.
All right. And thanks to all of you for joining us for this week's edition of It's Your City, brought to you by Lake Tahoe Farmers Markets and Mom and Pop's Diner in downtown Carson City. If you're interested in sponsoring a future edition of It's Your City, please contact Darla at the address shown on your screen. I'm Cortney Bloomer. We'll see you next week.